Obstetrics and gynecology is a profession in which we have an opportunity to be involved in really important points in people's lives. Some of those are joyous and some of them are not, but they're really important points in people's lives, and so it's an opportunity as a physician to establish a very close relationship with patients and to be able to do that through the continuum of their lifetime.
It's very exciting to be here at the Ohio State University Wexner Medical Center. Just being surrounded by so many physicians that are sort of at the top of their game and very engaged and passionate about their work, both their clinical work as well as their scholarly work and their research. And I think being surrounded by that degree of expertise sort of makes everyone raise their game and be on their A game. So not only does it promote you to be your best physician you can be, but to know you have those sort of partners to collaborate with is very exciting.
The Ohio State University Department of Obstetrics and Gynecology is a large clinical department within the College of Medicine at the Medical Center. It has the typical subspecialties that you would expect in obstetrics and gynecology, including very strong divisions of maternal-fetal medicine, gynecologic oncology, urogynecology. But what makes our department particularly unique is its very strong division of general obstetrics and gynecology. My particular interest in obstetrics and gynecology is in family planning, so reproductive health.
I do pediatric and adolescent gynecology at Nationwide Children's Hospital here in Columbus, where we provide a full range of reproductive health care, gynecologic care to girls and young women from the time they're newborns all the way through age 21.
I take care of adolescent, pregnant teens, as well as caring for the LGBT population.
I have a particular interest in psychosocial obstetrics and gynecology, which is sort of the interplay between gynecology and women's mental health. I have an interest in sort of all of those areas where there is influence of mind and society on how it affects women's health.
My interests are in lower genital tract disease. I'm also a gynecologic pathologist, and the understanding of cytology and GYN pathology lends itself to study of both vulvar disease and also cervical pathology.
Obstetrics and gynecology training for our resident physicians is a very important mission that we have in general obstetrics and gynecology. We want to make the best doctors that we can through that training program. And our training program covers not only the subspecialty that are important in terms of exposure, but also kind of the bread and butter in terms of obstetrics and gynecology.
My name is Omar Sino. I'm a fourth-year resident at the Ohio State University Wexner Medical Center. One thing that stands out and that is particularly helpful to me is that working with academic physicians at the university really helps us incorporate evidence-based medicine while at the same time providing patient-centered care, which I think at the end of the day provides the best medicine we can provide for our patients.
I think our residents are uniquely situated that they get to spend a whole month rotation doing nothing but pediatric adolescent gynecology. So they get a unique exposure not only to pediatric adolescent gynecology, but also an opportunity to learn a lot about multidisciplinary, collaborative, evidence-based care.
We're fortunate to have a Center for Sexual Health here at Ohio State so that the residents can be exposed to the care of particular sexual disorders and learning not just from gynecologists but also from a psychologist who's involved and a physical therapist who we have involved.
The nice thing about the residency program here is that all of the residents are very eager to learn. I think that having somebody here now who specifically has an interest in LGBT populations gives them more exposure so that when they graduate, if that's something that they are interested in doing as attending physicians, they will have that ability to have worked with this population before.
The members of the Generalist Division at The Ohio State University have been mentors for me, and I know I can say this for my colleagues as well. I think they do it in a lot of ways, and in some aspects I don't think they realize it. For instance, in a passive manner, I think they're excellent role models for us. And then in a more active sense, I can come up to them and ask many questions. They're there for professional help, ethical, and to help me address ethical issues. And most importantly, they're always there when we have difficult decisions to make.
What I like about Ohio State University Medical Center is you have everything and everybody. It's a huge center, plenty of patients, lots of research opportunities, advanced care, yet it is a very approachable, wonderful group of people to work with, especially in our department.
We have folks who are out there on the front line of providing patient care, but also bring to our resident education areas of special expertise that will provide excellent baseline training, a foundation for their practice in the future.